Good morning, Mrs. Marie. How are you feeling today?
Bonjour docteur, je vais bien, mais honnêtement, je ne comprends toujours pas bien ce qui m'arrive. Je sais que vous avez parlé d'apnée du sommeil, mais je ne sais pas vraiment ce que c'est.
I understand. Let's start with that. Sleep apnea is a condition where your breathing stops and starts repeatedly while you sleep. This can happen because your throat muscles relax too much, blocking the airway. When your brain realizes you're not breathing, it wakes you up just enough to take a breath, but this disrupts your sleep cycle, making you feel tired even after a full night's rest.
Oh, cela explique pourquoi je me réveille épuisée. Mon mari m'a dit que je ronfle beaucoup et que parfois je fais des bruits d'étouffement dans mon sommeil.
Exactly. Those choking sounds are what we call apnea events. These are the moments when your breathing stops. When they happen frequently, they can put a lot of strain on your heart and lead to other serious health problems like high blood pressure, heart disease, and even strokes.
Ça a l'air effrayant. Je ne savais pas que c'était si grave.
It can be, but that's why we're treating it. I prescribed you a CPAP machine, which stands for continuous positive airway pressure. It keeps your airway open while you sleep by providing a steady flow of air through a mask.
J'ai essayé de l'utiliser, mais le masque est inconfortable et je me réveille pendant la nuit. C'est difficile de s'y habituer.
That's a common concern. It takes time to adjust, but we can find the right mask for you. Are you having trouble with the mask fit or the tubing?
Je pense que les deux. Le masque est trop serré et parfois j'ai l'impression de ne pas avoir assez d'air.
We can try a different mask style. There are nasal pillows, full face masks, and nasal masks. Also, ensure that the tubing is positioned correctly so it doesn't get twisted or blocked. Are you keeping up with supply maintenance? The tubing and water chamber should be cleaned regularly.
Je les nettoie, mais peut-être pas aussi souvent que je devrais. À quelle fréquence dois-je le faire?
Ideally, you should clean the mask and tubing daily with warm water and mild soap. The water chamber should also be emptied and refilled with distilled water every night. If the machine isn't properly maintained, it could cause irritation or even infections.
Je ne savais pas que je devais le faire tous les jours. C'est peut-être pour ça que j'ai parfois la gorge sèche.
That could be a factor. Also, have you checked your progress report from the CPAP machine? It tracks your usage and the number of apnea events you experience each night.
Non, je ne l'ai pas vraiment vérifié. Je ne sais pas comment faire.
No problem. I'll show you. The machine records how long you've used it, how well the mask is sealing, and whether your apnea events have decreased. If they haven't, we might need to adjust the pressure settings.
Ça a du sens. Je me sens fatiguée même après l'avoir utilisé. J'espérais être plus reposée à ce stade.
It takes time, but we'll get there. I'll download your progress report and we can make adjustments. By the way, if you ever need help with your machine, there's a sticker at the back with a phone number for support. You can call them if you have any issues setting it up or maintaining it.
Oh, je ne savais pas ça. Je vais m'assurer de vérifier.
Great. In the meantime, we'll make sure your mask fits well and I'll give you some tips for better comfort. If necessary, I can also refer you to a sleep specialist.
Merci, docteur. Je veux vraiment que ça marche. Mon mari dit que je ressemble à un médecin endormi, silencieuse parfois, puis tout à coup en train de halter.
That's a good way to describe sleep apnea. Let's get you feeling better so you can wake up refreshed. I'll see you in 2 weeks for a follow-up.
Ça me va. Je ferai de mon mieux pour suivre vos conseils. Merci, docteur.